Good morning, ladies and gentlemen. It is a really great honour to be here with you this morning at this National Patient Safety Conference. And I must say, I really am very, very proud of the many people in the Department of Health who have worked so hard over the last number of months and beyond to arrive at this point. I'm very proud of the work of Dr. Kathleen McLennan and her team, and of the work of our Chief Medical Officer, Dr. Tony Hula. And today is an extraordinarily significant day in the development of ensuring that we have a health service that is more responsive to the needs of our patients and that puts patient safety at the absolute core of everything we do. And I often think, and in the 7 months that I've been Minister for Health, I've often seen that in our health services, we spend so much of our time dealing with the issue of the day, and that's important. It's important to people when they're faced with the issue of the day. But there must be space in our health services to actually take a look at the bigger picture, to take a look at the structural change that needs to take place, to take a look at the systems that need to be put in place to make sure we learn when something goes wrong, and to make sure that we act to make sure at all times the patient voice is at the centre of our health service. And that is what today is about. So the significance of this event should not be lost on any of us. And today, in a venue that has been at the heart of Irish history, indeed, for over 800 years, we are marking a significant event for our patients, for our public, and for the health service providers. And today I'm so pleased to launch the National Patient Safety Office, which will be located within my department. The World Health Organization has declared patient safety as a global public health problem. So this is not an Irish-specific phenomenon. 1 in 10 patients will develop a healthcare-acquired condition, and international studies indicate that 3 to 4% of deaths in acute hospitals are actually avoidable. While we can be confident, and I think it's fair to say that we can be confident, that much of the care we provide in the Irish Health Service is of a high quality, we all know that the delivery of healthcare and the implementation of health systems is never without risk. The challenge we face is not the achievement of absolute perfection, but the development of a service in which the risk of harm and medical error occurring is minimised, the capacity to identify it when it does occur is maximised, and the systems we have ensure that lessons are learned and inform quality improvements. And I think we want to create a health service that we minimise the chance of something going wrong, but that when something does go wrong, the service responds in an informed, transparent, compassionate manner. And when I've met patients who've had a negative experience in the Irish Health Service, that's what they tell me. If only someone could have explained to me what happened. If only the system could have responded more compassionately. They've emphasised to me the importance of the system not closing in on itself and defending the corporate entity. The need for a compassionate health service that when something goes wrong, we put up our hands and say, this happened, here's why it happened, and here's what we're going to learn from it. And we face this challenge in a world of more complex care where, thanks to improvement in medicine, patients are living longer, people are now living longer but with multiple illnesses, and also we have technology playing a much bigger role. The CEO of the State Claims Agency estimates that the cost of claims in Ireland will exceed €300 million in 2017. So there's an economic piece to this as well. When we consider the absolute magnitude of that figure, it's clear we need to change the picture. We need a vision where we're preventing patient safety incidents and introducing patient safety measures to promote and assure safe health systems in a system that listens and in a system that learns. But of course, patient safety is about an awful lot more than one crude monetary figure. It's about people, it's about dignity, it's about empowerment, and it's about learning. I and my department are fully committed to progressing a programme of major patient safety initiatives. And this has been an important year for patient safety, and we are making significant strides in a number of areas, and I really do believe that. The establishment of the National Patient Safety Office is a key milestone in providing sustainable leadership for patient safety policy and for innovation. This office will focus on patient safety legislation, on the establishment of a national patient advocacy service, a really important development, on the introduction of a patient safety surveillance system, on extending the clinical effectiveness agenda, a national patient experience survey. We've surveyed everything. It's really important we now add in the voice of the patient to those surveys, and the setting up of a national advisory council for patient safety. Within the programme of legislation, we intend to progress the licensing of both our public and our private hospitals, the Health Information and Patient Safety Bill, and provisions for open disclosure, which will in fact be discussed at our Oireachtas Health Committee this morning. Another key marker for a health service, though, is how we listen to patients in order to continuously improve our health system. And I want to be the Minister for Health of a health service that listens more. Later this morning, you'll hear about how my department, HIQA, and the HSE have joined forces and are working together towards the launch of a national patient experience survey in 2017. For the first time, we will get a broad input from patients themselves to inform planning and delivery of a better health service. And this builds on our commitment to move towards a system that is less closed and is more open and more transparent. Disclosure and reporting are opportunities to learn, to improve, to address errors that have happened, and to apply the lessons to make the service safer for the next patient and for the patient after that. The open disclosure provisions that are progressing in the Civil Liability Amendment Bill before the Oireachtas currently form part of a number of initiatives to improve the management of patient safety incidences. HIQA and the Mental Health Commission are at an advanced stage of developing standards on the conduct of reviews of patient safety incidents, which expand on the national standards for better, safer healthcare. This set of standards, along with the mandatory reporting of serious reportable events provided for in the Health Information and Patient Safety Bill, and those provisions that I've outlined intended for open disclosure, will provide a comprehensive, patient-centred approach towards preventing, managing and learning from incidents in a consistent manner and in line with best practice. And I do want to say this morning that I don't think we would be here this morning were it not for the bravery of Irish patients who came forward and shared their experiences in our hospitals, and the bravery and courage of Irish healthcare staff who also came forward to outline how they believe we must do better. Were it not for the courage, the guts, the backbone and the determination of that patients, and often patients and families in the midst of grief, and indeed healthcare professionals, I don't believe we would have arrived at this point this morning. Tackling patient safety, of course, though, requires a whole health service approach to prioritise key initiatives, working with colleagues within and across services for the better good of the patient. And I'd like to acknowledge the new and enhanced commitment in the HSE service plan, which we will publish very shortly, for the delivery of coherent and planned patient safety programmes across all divisions and all services within the health service. Earlier this week, as many of you will know, HIQA published its report on progress at the Midlands Regional Hospital in Portlaoise. It is clear that the maternity services in Portlaoise have come a very long way. We can see that the implementation of standards and guidelines such as early warning systems, clinical audit, reporting of adverse events, and the publication of safety statements can be implemented successfully and verifiably. In addition, Portlaoise Maternity Services are reporting monthly maternity patient safety statements and are participating in national data collections, including the Irish Maternity Indicator System. This has led to confirmation this week by HIQA and that the hospital's maternity services are performing in line with nationally reported rates. And I want to pay tribute to the many brilliant staff in Portlaoise who have worked so hard to bring about those improvements after a number of extraordinarily difficult years. The commitment of our frontline staff they own this achievement. They are the ones that have brought about this achievement in the delivery and the improvement in the delivery of our maternity services in Portlaoise. But this is about more than Portlaoise, because we need to take the lessons from these improvements and the lessons from the story of Portlaoise and apply them to other services. In order to create system-wide change, we have to return to the basics. We have to look at the areas at most risk, we have to plan for scale, and the introduction and adoption system-wide of national clinical effectiveness guidelines does really have the potential to save many lives. Some of our patient safety leaders, like Dr. John Fitzsimons and Dr. David Vaughan, together with our NCHD lead, Dr. Catherine Diskin, and nursing leaders, are demonstrating over the 2 days at this very conference how to take quality guidelines for patient safety and bring them to life in our health system. A guideline is only as good as its implementation within the health service. This is how we will make actual change at the patient's bedside where it matters, and I'm thankful to those patient safety leaders for being with us at this conference. I would like to particularly acknowledge Professor Hilary Humphreys, who has ably led the National Clinical Effectiveness Agenda and brought it to a place where it is now at the heart of decision-making for our health system. As he steps down as the National Clinical Effectiveness Committee Chair, I also welcome Dr. Karen Ryan, who is the Clinical Lead for Palliative Care, and will, I'm sure, continue to further develop the work and the influence of the National Clinical Effectiveness Agenda. This is so important that we put clinical effectiveness and evidence-based decision-making at the core of our health service. I think in the past where we saw politicians making decisions that were better made by clinicians, we all saw where that brought us. We need to have programs of clinical effectiveness, and we need to make decisions on the basis of the evidence. And as long as I'm Minister for Health, that's exactly how I intend to make decisions. A significant challenge for our health system is to gather and use the information available to enable us to measure and track patient safety, to allow us to identify the areas in which we've made progress, and more importantly, to identify the areas where further attention is required. As part of the new National Patient Safety Office, a National Patient Safety Surveillance System will be established in 2017. This will produce patient safety profiles by bringing together data from various health information resources, and the intelligence gathered will inform the setting of priorities for the Health Service Executive and the monitoring of implementation, importantly, of such priorities. Similarly, such information will be used by my department to inform the agreement of priorities with regulators such as HIQA, the Medical Council, CORU, and the Nursing and Midwifery Board of Ireland. An example of such information is the maternity patient safety statements, which have been introduced now in all 19 maternity units in this country. The next phase is now to introduce a patient safety statement across all of our acute hospitals. These statements, which will report monthly on key patient safety trends like complaints, infection rates and falls, will be published by the hospitals monthly and will be the basis for ongoing patient safety improvement programs. This will bring about a new layer of transparency and openness in our health service. Robust clinical audit at a national level provides further opportunities to examine our practice for quality improvement. Supports for professionals undertaking clinical audit are included in the forthcoming Health Information and Patient Safety Bill that is currently with legal drafters and will indeed be considered by the Oireachtas Health Committee next week. To support this legislation and to create national standards for conducting clinical audit, the NCEC has developed a clinical audit quality assurance framework. Later today, the Chief Medical Officer, Dr. Houlihan, will introduce the first NCEC quality assured national clinical audit, the trauma audit, a very important piece of work. In time, we can look forward to the Irish health system having a set of prioritised and quality assured national clinical audits in place. This ensures that we're developing a health system that will be more evidence-based, with clear clinical leadership, moving forward on our agenda for patient-centred care. My department will also continue to build the National Healthcare Quality Reporting System. This report makes clear that many areas of our health service are performing well. Immunisation rates have improved and cancer screening rates continue to improve. We continue to see a downward trend for hospitalisation for heart failure and for diabetes. It also shows that survival rates for breast and colorectal cancer are improving. And a further positive is the continuing downward trend of the last decade in deaths following admission to hospital with a heart attack or with a stroke. This analysis also identifies areas where there are clearly room for further improvements. In particular, considerable variation can be seen between counties in rates of hospitalisation for common chronic diseases, asthma, diabetes, heart failure. Identifying this variation is a first step in addressing the reasons why this variation exists and how we set about collectively improving it. Ensuring safety, high-quality care services requires all of us, including my department, to consider the most appropriate evidence-based decision-making processes for policy and practice that can promote the achievement of best possible health outcomes for a given level of investment. The National Clinical Effectiveness Committee has worked in partnership with the HRB on the best ways of meeting this requirement, and today we are announcing a collaborative hub, the HRB Collaboration in Ireland for Clinical Effectiveness Reviews, that's quite a mouthful, to support the work of the NCEC. I'm pleased to hear and see Dr. Graham Love here today, who will introduce Dr. Marion Ryan as the new director of the hub this morning, and we wish Dr. Ryan well. An example of good work supported by the HRB already was the publication earlier this year of the Irish National Adverse Events Study, and I understand there will be a presentation later today on this important piece of research. The National Patient Safety Office will work with the Health Research Board to build our baseline patient safety information and in parallel develop and implement effective new methodologies to address patient safety challenges as healthcare evolves. This ambitious programme that I've tried to give you an overview of this morning is intended to provide the leadership and the continuity to drive patient safety actions in our health service into the future. Above all, these initiatives are for our patients and for the wider public to improve their experiences of the healthcare system, to reduce harm and, where possible, to save even more lives. I will appoint a National Advisory Council for Patient Safety in 2017 to guide this work. This council will have an independent chair and will have significant representation from both healthcare leaders and, importantly, from patients. I see this council as providing advice and guidance to inform the policy direction for my department's new National Patient Safety Office in the delivery of its 3 core functions: patient safety surveillance, patient advocacy, and building further on the work of the National Clinical Effectiveness Committee. Nationally, I expect that the HSE will place particular emphasis on patient safety. Sometimes in the midst of much review and criticism, we can forget that as a health service we do get an awful lot right. At the heart of patient safety is the professionalism of the staff who operate in the Irish Health Services. That is you, the frontline health professionals, the managers and the leaders of our service. And your presence here today and yesterday in great numbers confirms your commitment to your patients and your role as leaders for the patient safety agenda. This conference is a showcase for the ongoing work taking place at local and national level on improving patient safety. We need to take pride in what we are achieving, but at the same time commit to continuous improvement and to learn from each other. That's what this event is about. That's what this new office, which will be at the core of my department and its work, is about. And we really now do need to get on with turning all of these plans into reality for our patients and for our health service. Gurv Míle Maith.